All right, hello everyone. If you can hear me, please type it in the chat box so I know my sound is working. All right, thanks everyone. Again, thank you for all attending our FSA webinar. We'll start with a pre-recorded overview video. Your microphones will be muted during the presentation, but feel free to type in any immediate questions you have. Our representative here from FSA, Victoria, is here to help. And after the presentation, you'll be able to hear your questions answered by Victoria. And with that, let's get started.
Welcome to the San Francisco Health Service System Open Enrollment webinar. We're so glad you've joined us today to learn about your benefits for plan year 2025. The open enrollment period is the time each year when all members can enroll in benefits or change their current benefit coverage for the upcoming calendar year. During this period, you can change from one plan to another, waive your coverage, add or remove dependents from coverage, and enroll in flexible spending accounts. If you do nothing, your current benefit elections will roll over to the next plan year. However, flexible spending accounts do not roll over. Eligible members must re-enroll in the flexible spending accounts every year to participate. All new benefit choices are effective January 1st, 2025. Here are some key dates for plan year 2025. Open enrollment starts at 8 a.m. Pacific Time on Monday, September 30th, 2024, and ends at 5 p.m. Pacific Time on Friday, October 25th, 2024. You may enroll through the e-benefits portal on the San Francisco Employee Portal. Paper applications must be postmarked by October 25th, 2024 to be accepted. During the webinar, all attendees will be muted and off camera for the entirety of the presentation. We encourage you to ask questions at any point during these presentations. To ask a question, open a chat box by clicking on the chat icon in your menu bar. You may find the menu bar either at the top or bottom of the screen, depending on whether you are using a computer, a mobile device, or a tablet. We will answer as many questions as time allows during the Q&A portion of the presentation. Important. Please do not share personal medical information in the chat. All chat text is viewable by all attendees, and we recommend a one-on-one consultation if you have specific personal concerns. If you have a question that includes personal or private medical information, please schedule a private one-on-one consultation with our health plan vendors during our open enrollment office hours for SF-HSS members, which can be found at sfhss.org/OE2025. If you have eligibility questions, please call SF-HSS Member Services at area code 628-652-4700 or visit our offices at 1145 Market Street, 3rd floor, during our business hours listed on the screen for further assistance. And lastly, we want to remind everybody to get their annual flu shot and COVID booster to protect yourself and your loved ones during this fall and winter. And with that, our presentation will now begin.
Welcome to the City and County of San Francisco's FSA Open Enrollment. What is a flexible spending account? A flexible spending account is a pre-tax savings account that you utilize pre-tax dollars on eligible expenses. When you enroll in an FSA plan, you save on state, federal, and FICA taxes. This combined amounts up to about a 30% savings, which decreases your taxable income and increases your take-home pay. How does the plan work? Choose your annual election. Decide how much to set aside into your flexible spending account by estimating your predictable expenses for the upcoming year. Once you have determined this amount, you will enroll during open enrollment. And then your annual contribution amount is divided up by the number of paychecks that you have throughout the entire year and is deducted on a pre-tax basis and loaded onto a debit card for your use. Here is an example of how the plan works. Say you elect $780 and you are paid on a biweekly cycle, which would be 26 paychecks per the year. That's $30 per paycheck that will come out pre-tax. There are two accounts that are available to you. The first is the Health FSA account. This account covers any out-of-pocket medical, dental, or vision expenses for you and any of your eligible dependents. The second account is the Dependent Care FSA. This covers the cost of daycare centers, after-school programs, summer day camps, babysitter services, and it can also be used for elder care facilities as well. The first account is the Health FSA account. This account has a full annual election amount that is available to you on the first day of your plan year. This is done purposely so that you do not have to wait for the account to stack up. Those funds are ready and available on the first day of your plan year. Once you are enrolled in the plan, you can only change your election amount if you have a change in family status or at open enrollment time. You do have a carry forward provision attached to the Health FSA plan. At the end of the year, you can roll over up to $640 into the following plan year, so long as you have a minimum of $10 remaining in your account. The carry forward provision does fluctuate year to year, and it is coinciding with the health maximum. So for this year, the maximum amount is $3,200. Therefore, the carryover maximum is $640. You do have a minimum annual contribution amount of $250, and that is an annual minimum contribution. Here are some examples for the Health FSA eligible expenses. Things like copays, deductibles, dental work, eyeglasses, over-the-counter medications are now accepted, as well as prescription medications. For a more extensive list of eligible items, please visit the FSA store. On this website, you'll find a lot of great tools and resources for eligible items. You can use it as a reference tool, or you can shop around on this website. They do often have coupons, free shipping. You can also visit the Amazon FSA store as well. All great resources so that you do not forfeit any funds once you get to the end of your plan year. The Dependent Care FSA. This account does have different rules with it. This is a pay-as-you-go account. What that means is you do have to wait for those funds to be withheld from payroll in order for the account to be funded. It is not front-loaded. You can only change your election amount if you have a change in family status or, again, at open enrollment time. This account is a use it or lose it account. Therefore, any funds remaining in the plan will not roll over. So you want to make sure that you spend down that account balance. You have a $250 minimum contribution on this account and a $5,000 annual household maximum. And this is a household maximum. It is not an individual maximum. Here are some examples of dependent care eligible expenses. After school programs, caregivers for disabled spouse or elderly dependents, daycare centers, day camps, so long as they're not overnight, elder care facilities, and nursing schools. The benefit card. When you enroll in the card, it is automatically activated upon first use. The debit cards are valid for roughly 3 years, and they do come with their own unique expiration date listed on them. If you are currently active in the plan for this year and you anticipate enrolling again for next year, please check the expiration date on your card. If it is not expiring, please make sure you hold on to it. If it is and you plan to remain active in the plan, a new one will be sent to you automatically. Should you need any additional cards, you can certainly order some free of charge right through your P&A account online, or you can call customer service or order additional ones through the P&A mobile app. How to submit claims. Should you need to submit a manual claim, you can do so through the mobile app, our website, or you can fax or mail a claim to us as well. Just some reminders, the Health FSA and dependent care claims are due by March 31st of 2026. Reminder, any amounts between $10 and $640 into your Health FSA will carry over into the next plan year. Any amount over that $640 will be forfeited. How to get reimbursed. Should you need to submit a manual claim and you need to get reimbursed, there are two options available to you. The first is direct deposit. You can sign up for this right through the P&A website. It is completely free of charge. The second option is a hard copy check. If you would like to get reimbursed through a check, there is a $25 reimbursement minimum before a check is mailed out. The mobile app. If you have not downloaded the mobile app, I would strongly encourage you to do so. You can register for various different account alerts. You can submit claims, check account balances, upload debit card documentation. And we also have a very useful feature on our app called the Easy Scanner. This scanner is great for point of purchase. So if you are in the store and you're wondering if an item is FSA eligible, if you open the P&A app, click the Easy Scanner, you can scan the barcode on the item and it will let you know if that item is FSA eligible or not. Here are a few snapshots from the mobile app. So you can log in using various different diagnostics. You have all of these different account alerts that you can toggle on and off. And then you can view various different direct deposit options, upload claims, you can order benefit cards. Again, the Easy Scanner is listed on here, so you can see a lot of different information and really customize the plan to work for you. Customer service. So these are our hours of operation. We are on the East Coast, so Pacific time, we are open from 5:30 a.m. to 7 p.m. We do also have live web chat on our website. And then here are our phone numbers listed as well. Should you need any further P&A and FSA education, you can visit our YouTube page and visit Penny the Panda. She is a great resource tool that goes more in depth about the accounts that are offered to you and some fun little tidbits about FSA in general. Thank you all for attending your FSA Open Enrollment hosted by P&A.
All right, that concludes our pre-recorded video. And at this point, again, I wanted to reintroduce Victoria from FSA. If you have any particular questions, please feel free to type it in the chat box here. And again, you are still muted. Or if you have any general questions regarding open enrollment, we have a couple of our HSS representatives from our member services that can possibly answer those. So at this point, Victoria, you have the floor.
Thank you. Yeah, so I did answer a few questions just during the presentation, so I just want to read those back for anyone who may also have the same question. So the first one is, what if your provider does not accept credit or debit cards? Can you ask to be reimbursed? So yes, you can always submit for manual claims if the debit card is not accepted at the point of purchase. You would just send in a manual claim, which you can do so through your P&A account. I have another question on my P&A app. I have two runout, rollover, and health FSA. what this question is referring to is that they're seeing two buckets of elections in their FSA account. So if you have carried over funds from the prior year, you will notice that there are two buckets reflected in your P&A account. So your new year election is exhausted prior to that carryover amount. So once your new election has been depleted, then it dips into that carryover amount. I did also drop the phone number, which you did see as well in the presentation for customer service. In order to order additional debit cards, you can also do so through the P&A app as well. And again, they are free of charge and they are valid for roughly 3 years. There are some other questions in here on what happens if you leave employment mid-year. Those questions I am going to defer you to your HR department directly.
Maybe Jaak, I know see Jaak or Sonali, could you possibly answer that question if someone decides to leave early and get separated from us?
So that question should be handled with HR directly as a personal conversation.
Oh, got it. Okay, great.
I see another one for new employees who had FSA at their previous employer. Would they be able to elect the maximum FSA amount at CCSF? So that's another question for HR. However, you are at the end of your plan year now currently. So unless you were going to be enrolling for the end of the plan year, it would be a moot point at this point because your new election wouldn't start until January 1st.
Thanks, Victoria.
So
This is, oh.
Go ahead.
Oh,
the next question was just a link to enroll. So you would actually enroll through the P&A website. So I don't actually have a physical link to provide to you.
Victoria, do you have that website available? That URL?
Let me here. So what you'll do is when you go to P&A, because you guys utilize
While you're doing that,
go ahead. I'm going to drop the P&A website in the chat, but I am mistaken. You guys do not enroll through our P&A portal. So that is handled on the city's end when you guys enroll with all of your other benefits. But this is the website for anyone who needs to visit our website, and there is additional information on there. You can get to our YouTube page from our website as well as the FSA store, which I find both to be very helpful. If you have never enrolled in an FSA plan before, there's an FSA calculator that is listed on our website if you need assistance in determining how much of an election. So if you haven't been in the FSA plan before, I would strongly encourage you to use that calculator feature because you can put in there how much your out-of-pocket expenses are that you have personal to you. And what it'll do is it will tell you how much you're going to save in taxes. It'll give you a generalized election amount that we think would work for you. And then it would tell you based on your payroll frequency how much the deduction actually would be per pay cycle. I have another rollover question. So how the rollover works is once you get to the end of your runout period. Now your runout period is that time frame at the end of your plan year where you can still submit expenses. So once that period has ended, the account balance is looked at as one entire dollar figure, regardless if it's the new election or if it's carryover funds that you may have had from the previous year. That figure is looked at as a whole, and then whatever you have to roll over for next year will carry over. So it doesn't actually stack. Each year, a new carryover amount is established for the next year. So for the app, you don't have to necessarily register separately. If you have set up an FSA account online, then you should just be able to log in through the app. But you would need to register through either the app or the actual desktop website. Super bills, that I would direct you to customer service. It also depends on the actual claim that you're submitting. So that one I don't have a set answer for you. But again, I did put the customer service number in here, and I will drop it in the chat again because I see it's up a little bit ways. Okay, so that's customer service. Is the card, well, first the question is the card debit card, not credit card? Is the full year contribution amount available on day one of the year? So the card is technically it's neither a credit card or a debit card. It cannot be utilized to pull funds off of. So the amount is technically in your P&A account. You just utilize the card to access those funds, or you would submit for manual reimbursement. And the account is front loaded, but it is only front loaded on the health FSA account. If you're inquiring on the dependent care FSA, that one is not front loaded. It's considered a pay as you go account. So you would have to wait for those payroll deductions to add up in that account for funds to be available for use.
Victoria, I'm just going back. Can you, and this may be for Sonali or Yak, but can you confirm, can someone confirm the way to sign the location on the website where they can sign up for these services? I know, Victoria, you put in the P&A website, but just for Yak or Sonali or Jay to drop in where our members can sign up online on our website, if there's a link there too. And I'll hand it back over to Victoria.
Someone still may be muted.
Either one can get back to us. I just, before our time runs out, it would be good to have that in the chat. So
Okay,
Victoria,
yeah.
yeah, if you wanted to go to the next question.
Yeah, so if I am only working at my current position until April, should I decrease the amount I set aside for FSA, or will it just take out the monthly amounts for what would have been, say, $650 for the year? I'm not sure I'm understanding the question. Let me reread. If I am only working at my current position until April, should I decrease the amount I set aside for FSA, or will it just take out the monthly amounts for what would have been, say, $650 for the year? Eric, I think you're meaning what happens if you leave your position with the city in general, correct? Not an actual position switch within the county. So again, I'm going to direct you to HR because those are conversations that you will have to have with HR in terms of what they are going to do to handle your account. But just for everyone's knowledge, if you know that you are going to be leaving employment, you are not allowed to enroll in an FSA plan. You are supposed to be an active employee for the full plan year in order to enroll, because this is a payroll deduction account. So for example, if you know that you're retiring in, let's say, June, you would not be allowed to enroll in the FSA plan.
And just for everyone's information, I dropped in the website for FSA. It has all the information on there as far as the link. And I'll just drop it in again so it doesn't get buried all the way up here.
I have a question. I will be on maternity leave for 4 months. Would I be able to elect for FSA? Again, talk with HR, but you should be able to enroll in a flex plan. What they would do is, it depends. Sometimes maternity leave kind of is a little bit of a gray area depending on how it's handled with your paychecks. You know, sometimes when you come back to work, there's kind of that catch up method, especially for health insurance premiums, where you kind of pay back the plan. So I would defer you again to HR, but there should be no reason why you cannot enroll so long as you are obviously coming back to work. Okay. So, your debit card. So, if your debit card is expiring in December of 2024, if you are going to remain active in the plan and you're going to re-enroll for the new year, a new one will be sent to you automatically. So, it is important to make sure you check the expiration date on your card because they are unique to that specific card. If it's not expiring, make sure you hang on to it. But if it is, you will get one new automatically before the beginning of your plan year. I see in the P&A calculator, it has a section for adoption. Could you share more about this? So actually that account is not available to you through the city and the county. It is just on our website as it is considered an FSA account. Fraud protection. Really, I don't really necessarily have an answer for you, I guess, in that terms of sense. If your card does get compromised or stolen, it is going to be a case by case situation. Obviously, we will help and guide you as best we can, and we wouldn't want you to forfeit any funds that maybe, you know, someone got into the wrong hands. So that would be a case by case situation. The FSA covers non-prescription sunglasses. No, it does not. So they would have to be prescription sunglasses. Can I use the debit card to pay for dependents after school program, or do I need to submit a reimbursement form? So if the after school program accepts the card, you definitely can utilize it. I know sometimes even parents keep them on file. So as the funds become available, they request that the transaction be pushed through. So it really depends on how the program works, but you can utilize the card for it. If not, you can always submit those manual claims. Sometimes if it's maybe one larger bill, what you can do is submit that reimbursement to P&A, and as the funds become available in your account, we can kick back reimbursements to you. So again, another rollover question. Oh, you just edited the question. So if I roll over from FSA 2024, say $100, and use my benefits card in 2025, will the debit automatically come from the remaining $100? So the new year election is exhausted prior to the carryover funds. So that, let's say that $100 in your example would be exhausted at the end, at the back end. I have a question about IVF expenses. I would defer you to the call center because I know IVF has a lot of different nuances and medications and everything that goes on with that. So specific questions regarding IVF, I would call customer service prior to enrolling.
So Victoria, if we pause right there, I know we have Olga on the call, and I'm not sure if that would be a question you could answer, Olga, or if member services, being a specific question for a member, needs to call in. What do you recommend, Olga?
I'm sorry, can you repeat the question because I joined late from the last
Yeah.
webinar? Can you let me know which question you'd like answered?
Yeah, I'm going to find it for us. Victoria was just nice enough to read it aloud. It was, does FSA cover IVF expenses?
So I believe that for IVF, you're first going to want to go through your plan, and then the portion of it that you are responsible for, depending on which plan you're enrolled in, then that portion I would recommend that, based on Victoria's answer, is to connect with the customer service line, because it's just very specific expense, to confirm the additional portion to be able to use FSA funds for. Great.
Yeah, I
Thanks.
know IVF, it is an FSA eligible expense. I just wouldn't want to tell you that everything under the IVF umbrella is covered.
Great. Thanks for both of you being able to chime in on the answer.
Computer glasses are unfortunately not FSA eligible. Do I need to re-enroll for health FSA for 2025 if I know I will have rollover balance for 2024, or will it roll over even if I don't re-enroll? If so, then I have to put in at least $250 for the year. I do not believe you have a re-enrollment requirement to access your carryover balance. I want to check the SPD though first before I confirm that, but I do not believe that there is a re-enrollment requirement.
So I can answer that, and I think I already answered
Okay.
it in the chat. Yeah. So if you are not looking to enroll in new plan year 2025 funds, you do not have to re-enroll. But you want to make sure that your rollover amount into the next plan year is not more than the maximum for the plan year. And also, you want to make sure that it wasn't rolled over before. So it's a one-time rollover amount. And there is a maximum. So I believe for plan year 2024 funds to roll over, it's 600 and a maximum of $610. And this is for FSA health savings accounts. There is no rollover for the dependent care FSA.
Yes, correct. And then the rollover for 2024 into 2025 is $640.
No, sorry, since we're a year behind, it's 610 for plan year 2024 and 640 for plan year 2025.
Gotcha. Okay. Yep. So
Yeah.
for anyone listening, so if you're active in the plan now, you can carry over up to $610 into 2025. So just make sure you don't have any funds exceeding that in your account. And again, that is specific to the health FSA only. It cannot be utilized for the dependent care account.
And again, these are all great questions, but since we have no one putting in a lot of questions in the chat box, just wanted to do a short plug. If you haven't gone to your e-benefits and online portal, please select and elect your plans for the next year and make sure you hit that submit button. Otherwise, if you don't hit that submit button by this Friday at 5 o'clock, none of your new plans will reflect for the next year. So just a short reminder.
I have a good question here. Does FSA apply to when services are rendered or when employee pays? For example, services rendered in December of 2024, but is paid in January 2025. The services must be rendered within the plan year that you are utilizing the funds for. So if you are submitting an expense for 2025, it would be for 2025's election amount. So funds that do not roll over are forfeited. That is an FSA rule. So make sure in the health FSA fund, you do not have an excess of 610 or more in that account, because you will forfeit those funds. So yes, for the dependent daycare account, it is only for children who are under the age of 13. So children who are over the age of 13 are no longer eligible under the dependent care FSA plan. Mental health services are considered an FSA eligible expense. Yes. And again, for anyone who has questions regarding expenses, there is a list listed on P&A's website. I know it seems like that's a lot of the questions that we're receiving. There is a list located on P&A's website for you to reference that has quite a large number of these services on there.
Victoria, I'll drop the link here in the chat box.
Thank you. Okay, so if service is in 2024, but the billing came out in 2025. So this is when your run out period comes into play. So let's say you go to the doctors in December. A lot of times, if you don't pay at the point of service at the office, they'll send you a bill in the mail. And sometimes that can come a month or maybe even 2 months after the fact. So since the service is rendered in 2024, as long as you submit for your receipts before the end of March, you can submit claims for that expense. So long as given that you have the funds available from 2024 to pay for it. Do we have any other questions? I know we got a lot covered.
Right. If you have any other questions, since we have our representatives here from HSS as well as Victoria from FSA, please type it in the chat box. Going once, going twice. Okay, here we go. There's one more new question there from Robert, Victoria. Or actually,
It looks like it's for me.
Yeah, perfect.
1 second, let me just go ahead and read that. So if you enroll and you happen to separate prior to paying for the full amount, your any portion of your funds that are still available after your separation date, you will not have access for. So you'll only be able to seek reimbursement for services prior to your separation date.
There's actually a last minute really great question that came in regarding orthodontics. So certain expenses can be spread out over multiple plan years, and orthodontics, meaning braces, that would be considered an expense that you can span over multiple years. I've had braces, so I can attest to they take quite a few years. So when you enroll in that plan, you can expand those over multiple years. Just make sure that you keep enrolling so that you have funds available, given that you can only carry over for 1 year. But yes, you can have that over multiple service years.
I think this one may be for me. How long do you have to submit claims for services rendered prior to separation? I believe, or maybe that is for you, Victoria. Would it work the same way as the additional time period from January to March for prior year's claims?
You just want to make sure. A lot of times the run out period is the same for terminated employees, but I'm just checking quick. So you wouldn't technically have, it depends on when you would terminate employment. It would be the same length of time, but not the same date, for instance. So it wouldn't necessarily be March 31st. It would just be 90 days from whenever you terminated.
Perfect. And the termination applies for leaving employment or retirement.
Yes.
Again, we want to ask the question if anyone else have any other questions, since we have all our representatives here. So we'll wait a couple more minutes.
Oh, there's a question, where do the forfeited balance goes? It goes to the administrative cost of the plan. So it goes into the, I believe the HSS trust fund.
You have any other
Any-
questions?
Yep.
I see them people are in the meeting. Orthotics are considered an FSA eligible expense, yes. Dependent care question on dependent care reimbursement when filling out claims for out-of-pocket expenses. In this case, the after-school program that bills me monthly. Should I complete separate claim line items for each receipt, or can I request reimbursement for lump sum and attach multiple receipts? You should be able to fill out one claim form and then just attach the multiple receipts, especially if the expense is the same recurring cost. You don't have to fill out numerous. You would only have to fill out more than one if you were seeking reimbursement over multiple times throughout the plan year in different increments. Mouth cords or retainers are FSA eligible, yes. So FSA is for any of your eligible dependents. So they do not have to be on your medical plan. They just have to be considered a dependent.
I know there's a question for whether HSS recoups front-loaded benefits. We may recoup them, yes. And I think the next question is a dependent question. Can FSA account cover my husband's medical dental costs?
We
Even
already
though
answered that
oh,
one. Yes, it
okay,
can.
perfect. Thank you.
All right. Any other additional questions at this point? Going once, going twice. All right. I mean, seeing none or hearing none, I think we're going to go ahead and wrap this webinar today. And again, we thank Victoria for joining us today and all our HSS representatives. Again, if you have any other questions, you can go ahead and reach us. We still have walk-ins here in HSS building. Oh, and I think we can squeeze in one last more question here. How about adult diaper under FSA? Is that covered?
That one I actually do not know the answer to, oddly enough. But you can call customer service. And again, Jay did drop in an eligible expense list in there as well. So if you have questions on what's eligible under the plan, please reference that list. You can also visit the FSA store. Amazon as well has an FSA store now too. So you can use those for reference points. But you can also, a lot of these questions you can also Google, and you can find that information online.
All right, and I dropped in the website there in the very last shot. And again, thank you all, and everyone have a great day. Thanks for our representatives.
Thank you so much. Everyone have a great rest of your afternoon.
And Jay, just to make sure that there will be a recording that'll go up on our website, so anyone can look back on the questions.
Yes, it should be available by tomorrow, and you could re-watch this video on your own time.
Thanks so much, Jay, and everyone who joined the
Thank
call.
you.